I'm Dr. Neil Thompson, chiropractor at Line for Life, and we're just going to run through the spinal hygiene exercises and the YWLT exercises, or otherwise known as the You Will Love These exercises. So let's start with the spinal hygiene exercises first. I know it's really helpful just for us to be able to show you exactly how they're done, so hopefully now you'll have much more clarity on this. So when we do the spinal hygiene exercises, you think of we're doing the exercises with the head and neck first, then the trunk and torso second. So head and neck first, we do what we call the yes, no, I don't know exercises, but don't do them that fast. It's just to help you remember the movement. You're gonna take 10 seconds to get to end range of motion, and then you're gonna hold for 5. So we're gonna start with forward flexion of the neck. So take 10 seconds to get to end range of motion. And then you're gonna, once you're there, you're gonna then hold for 5, trying to tuck your chin to your chest. 5, and then you're gonna slowly bring back up again. Now, obviously, if anything causes pain, stop before it gets to pain. And if it persists, let your doc know. Then you're gonna go into extension, hold for, take 10 seconds to get there. And then you're gonna hold for 5. Try to relax your shoulders as you're doing it. And then you're now going to go into the no part of it. So you're going to turn to the right, take 10 seconds to get there. And then you're going to hold for 5. And then you're going to come slowly back. And then you're going to take 10 seconds to get to the opposite direction. And do likewise. And hold for 5. And then back to neutral. It's important to hold it at end range because that fires off very different proprioceptors to while you're moving the neck. Then we're going to tilt the left ear to the left shoulder, 10 seconds to get there. I'm really just speeding up a little bit just for video demonstration purposes. Hold for 5. And then slowly back again. Always with these, do it slow and controlled, you're less likely to injure yourself. Hold for 5, and then back to neutral. And then we're going to go and now do forward flexion of the torso. And hold for 5. Then you're going to come slowly back up again. You can have your knees slightly bent when you do that. It's not a hamstring stress that we're trying to create. We're just trying to create flexion of all the vertebrae. And then you're going to go into extension. And hold for 5. All right, and then clasping your arms like so. Try not to let the pelvis turn. You're going to rotate the torso as far across as you can. Outside elbow slightly bent or bent. Inside elbow fairly straight. Hold for 5. And then likewise in the opposite direction. And then slowly back to neutral. Now we're doing the I don't know part, so bend to the left. Slide your arm down your leg. 10 seconds to get there. Try not to bend forwards or back. You're just going sideways. Okay, you're going to hold for 5. Slowly back up again, and likewise to the opposite direction. And hold for 5. And then slowly back up. Okay, so that's the spinal hygiene exercises. So that was what we refer to as the yes, no, I don't know exercises. Now we're going to do the YWLT exercises, or otherwise known as the You Will Love These exercises. So basically, you're going to be making a big Y, elbows straight, pull the shoulder blades back, bum back. So elbows back, bum back. Try to retract the head. Okay, you're going to hold for a full 20 seconds, making a nice big Y. Okay, keeping that head retracted and the bum back. Okay, and then you're going to go down to a W. Again, bum back, pull the shoulder blades back, keep the head back. Make sure your thumbs are pointing backwards. A common mistake is people do this. You want to actually do this. Externally rotates the shoulders. And then you're going to go to an L. It's a double L. Again, bum back, shoulder blades back. Really retracting between your shoulder blades and try and keep the head retracted. Palms facing up, thumbs pointing backwards. Again, hold for 20 seconds. And then you're going to go to the T. Same again. Bum back, head back, chin tucked, and palms facing up, thumbs pointing backwards. And once you've done 20 seconds of those, you're then done. Okay, and that'll really help counter this T-Rex approach that so many of us find ourselves in, especially when we're sitting at a computer or on a phone or even driving. Okay, and it should be burning a little bit between the shoulder blades once you've done that, because it means you've been working them hard. Right, so that's the spinal hygiene exercises and the YWLT exercises. Hopefully made more clear, and yeah, enjoy. They really make a big difference to getting the spine so much more mobile and improving your posture. Bye for now.